So Riverside is doing very well so far this year. I think the thing that is really most important is that when you look at the national landscape, there's been a tremendous decline during and since the pandemic in quality scores. Unbelievable declines, worsening. But not here at Riverside, thanks to all the great team members that we have, the medical staff, the nursing staff, everyone that works here. We've seen our quality scores, which are already very good, increase even further. And so that's something that we're both very proud of, and we're really determined to continue that, and sets Riverside apart from a lot of other health systems in the national landscape. Some of the other things that we're very, very proud of include the new psychiatric emergency department. That will be the first psychiatric emergency department in the Commonwealth of Virginia, the first. It will serve a tremendous, tremendous need, both during and since the pandemic, and honestly, if we were honest, before the pandemic, there was a tremendous need and tremendous shortfall for psychiatric and behavioral health and mental health services. And it's a new model. It works very well in California, it works very well in other parts of the country in the Northeast, and it'll be the first one here. Some of the other things that are happening, we have put forward an application, and by the time this is aired, I think we will have heard that we hopefully will have successfully put forward the application for an internal medicine residency. There's a tremendous shortage of doctors in this country already, and it's growing even more. If you tried to get a primary care physician, very, very difficult to do so. And one of the reasons for that, the major reason, is there aren't enough residency positions and medical residency positions in primary care in particular. And so by starting an internal medicine residency program here, we think it will complement our family medicine residency, which has been in existence now for over 50 years, as well as our emergency medicine residency program, which began just a few years ago and is already very, very successful. So that's going to be something we're very, very proud of, and we'll be building that over the course of the next several years. We have a number of primary care practice sites in Williamsburg opening, and the new Williamsburg Medical Office building will be opening. That will be a great entry point for people for both specialty care and for primary care. The situation nationally for hospitals and health systems financially is not great. But again, at Riverside, thanks to both the tremendous work of the team members and the support of the foundation and people involved in philanthropy, we're doing okay, better than most. And that has allowed us to continue to support our team members with increased rates of pay, which they definitely need, and to invest tremendous dollars into capital. Our capital budget for this upcoming year, whether it be new medical equipment or new types of buildings that we're building for patients, exclusive of things like Smithfield and the new hospital, that will be over $90 million this year. And so we're very grateful for the support we've gotten from the community and from all of our hardworking team members that have allowed us to be successful so far. And so it is a challenging environment, but Riverside's doing better than most, and we're very, very optimistic about the future. And thank you so much for your tremendous support.